something to JoAnna in that I think you're right. There is a black market, but there's also a lot of kids are getting it through dispensaries. Your dispensary and Mark's may be very, very discreet and doing things right, but the state law was so poorly written that there are a lot of people out there that are not following any type of rules.
Mayor, what's your take on this legalization thing? And do you look at this as a public official as primarily a law enforcement problem or a planning problem or a public health problem?
Well, it's a planning problem for us right now because we're looking at our ordinance, which is a land use ordinance about citing them. But we did not talk about minors and that sort of thing. We just talked about people getting recommendations from their doctors. So I think it's also a doctor problem. You know, they're not allowed to write prescriptions because it's illegal for the federal government, and yet they can write a recommendation, and some of them are looser with those recommendations than others. So right. I think the whole idea that the city council could decide how a doctor could recommend something is just ludicrous because we can't do that. We don't have that kind of knowledge. But so what we have to do is depend on the California Medical Board and that sort of thing. You know, so for the city government, all we're trying to do is figure out, we know that some people actually need this, and we're trying to figure out how many of those people live in the city and how to get them dispensed medical marijuana. But it's really a squishy thing from my viewpoint, because I don't know if you could. Somebody said that Berkeley had 2 dispensaries,
well,
or maybe it's 4.
Oakland has 4.
Oakland has 4 and Berkeley 2. Well, does that mean we should have 1 or 2?
How many do we have?
We have 1 legal one right now.
And how many?
Totally legal, has its permits and everything. We have several. This is where it kind of gets squishy. We have several that were already operating last April when we put in the ban, a year ago April when we put in the our dispensary law, and those are called non-conforming, and they have 3 years to come up with a permit. And that, to me, I voted no on that ordinance, so I'll give you my side on this.
So,
but 3 years is a long time.
Duly noted.
Yeah, okay, there. 3 years is a long time. We could have done 6 months or something, but we have those out there that are just able to dispense marijuana, and they know they can't get a permit, so they'll just keep dispensing. I don't know how legally or whatever.
And then you said that there were others as well.
And there are others that just open up, and then they say, "Oh, we need a permit." So they start through the process. Well, that's why you don't open a business and then say, "I need a permit." You're supposed to get a permit first. Right? It's crazy though.
No, but that's why I think it's crazy when we have 90,000 people in Santa Barbara that we don't keep a moratorium, because they had at one point 12. Now, I know a couple might have closed down, but a few more have opened. But for 90,000 people, where Oakland has 400,000 people and they have 4.
Yeah.
I think a moratorium on it until it's well planned is a really important thing.
Well, and that may be what the ordinance committee ends up with, is to put a moratorium on and to decide how many we need. And if it's 1 or 2, we're already done almost, so, and maybe that's it.
Let me switch topics just a little bit. We were just talking about Oakland, and Oakland voters just approved a 1.8% gross receipts tax on, I guess they have 4 dispensaries in Oakland, which is estimated to bring in something north of $300,000 for the city at a time when, cities and counties are suffering. What would be your take on that, Martin? You think that's a good public policy?
What, on taxing medical cannabis?
Mm-hmm.
I don't think medical cannabis should be taxed any different than anything else. Just being accepted will help the community by having its members come into the area and establishing a good reputation. I don't think that it should be taxed.
Do you collect sales tax from what you sell?
From what we sell?
Yeah.
We don't sell anything.
From what you provide?
No, we provide a service for our members. We don't purchase inventory in a wholesale atmosphere required to pay resale tax on it. As soon as we get a commercial building, well, then we do things differently.
Work through the bureaucracy.
Yeah, but it's a collective atmosphere. We provide a service for our members.
JoAnna, where are you on this tax question?
I think we have to look at short-term and long-term. I think on a short-term basis, it would be a good idea. I feel the same way that it is medicine, and we don't tax prescription medicine. So I think that will change at some point. I think what does work, though, would be a business license based on operational standards. So you pay a particular amount, and then that goes toward the city being able to pay for planning committee to review applications, law enforcement, et cetera, if that's needed. So I see it that way, maybe not taxing in the long run, because it is a medicine. It's just different than alcohol and tobacco, where it doesn't have a medicinal value. It's the medicinal effects of cannabis are irrefutable at this point. I just returned from an international cannabis research symposium in Chicago, where there's over 200 researchers. It's cannabinoids. We manufacture our own cannabinoids within our body, and they're finding a lot of illnesses are based on lack of those. They've actually named it the endocannabinoid system now, like your cardiovascular system or your reproductive system. So there's a lot of research, and that would be one of the benefits of legalization with regulation and education would be then we would be able to procure cannabis to do research. Right now it's regulated under the National Institute of Drug Abuse, and unless you're doing research to show the negative effects, which we have a lot of research already done, they do not allow cannabis to be dispensed or to be given for research. So everything is out of the country. So.
Medical marijuana tax is a new revenue stream for the city. What do you think?
Well, any tax we're going to have to take to the voters, because that's just Proposition 218.
80% in Oakland. They won 80% of the vote.
I know, and our voters did support legalizing marijuana. The 215. So I have no doubt that they would pass it. I have a problem with it because it is medicinal, and I don't want to pay taxes on my medicines. And if it's not medicinal, then why are we talking about it? Because we shouldn't be selling it. So that's kind of a hard thing. But what we've talked about in the city is doing a cost recovery fee on the dispensaries. So as they come up, we would have a cost recovery fee, which we don't do in the city of Santa Barbara, But dispensaries cost us in the law enforcement and in our land use planners. So
I have a quick question.
That would be that's our solution to that.
I have a quick question for you.
Sure.
If the city was to accept taxes from medical marijuana sales, would the city stick up to the federal government because now the city is making something on our activities? I know it's a difficult question, but that's the only reason why I would be in support of taxing medical cannabis is to provide community support from our local government.
Sure. No, I totally understand. It's been very difficult because it kind of depends on who's in the White House too,
yes,
as to
Obama
and
switched.
with the last Bush administration, they sent out letters to all the landlords in the city of Santa Barbara, and several of the dispensaries closed down. So we work very closely with the DEA agents and with the federal government on drug, on enforcing our drug laws. So we don't want to do anything that would, endanger that kind of a cooperation. But at the same time, I've talked to Lois Capps, to our congresswoman, about getting medical marijuana for medicinal use legalized, and there's just no support for that in Congress, and that's really what has to happen, I think.
Yeah, I think Representative Barney Frank from Massachusetts has introduced a bill which is going exactly nowhere.
Well, he probably has one person in favor of it right now. It's very hard to be in favor of it because it's so controversial at home.
Yeah. Let me, we're going to go to some questions from the audience in just a minute, but I want to read another email we got from a viewer who said, my mother died last Monday after a 2-year battle with ovarian cancer. It's been a long, hard fight. From her first surgery 2 years ago until the day she died, she received medical marijuana in pills, Marinol, for the unceasing nausea that accompanied her continual chemo and frequent radiation treatment. She also found it highly effective to minimize anxiety and depression, as well as giving her a more positive outlook. Is effective at reducing her pain. She would have died much earlier without it, we are certain. Penny, we were talking before the show about Marinol and your feeling that would be one way to address your concern about kids getting access to it. Talk about that a little bit.
Well, it is a prescription drug. It is controlled by the FDA, and so they have to get a prescription. And from the experience I have heard about and read about, it has the same effect. They don't have the ritual feeling of the smoke and that sort of thing. But as far as the effect on the person, it has the same effect. So I would be very in favor of that. I also think when we were talking about the prescription, not taxing it, because you don't want drugs taxed. Well, if it's handled like other drugs and controlled by the FDA, I agree. But if it's not, go ahead and tax it and get money for, if you're going to have it. If it's something that's just going to happen, then you might as well tax it.
JoAnna, talk about Marinol.
I've worked the last 20 years with hospice patients in pain management, also with the elderly, doing